All right, good morning. Let me put on my camera. All right, so everybody can hear me good, see me good? Okay.
Good
Good
evening.
morning, yes. Okay, good. Good morning, good afternoon, good evening, everyone, and welcome to session 2 of our practical workshop on conducting systematic review. I am Julia Ribeiro, Programs Officer at the SRN, and I am your moderator for today's session. Today, we'll be diving into defining eligibility criteria and study selection. The objective of the session is to equip you all with the ability to establish inclusion and exclusion criteria and implement a transparent study selection process. We are delighted to have you here and look forward to an engaging session. Before I introduce the facilitator, I will ask everyone to make sure your mic is muted and you could introduce yourselves into the chat. And I'm going to quickly share my screen. Just 1 second. Okay. All right, and before I introduce the facilitator, I'm going to share with you some quick key facts about the Systematic Review Network. We were formerly known, 1 second. We were formerly known as ACSRM, African Community for Systematic Reviews and Meta-Analysis. Officially launched on December 8, 2022 and December 19, 2022 at the University of Rwanda, and the University of Lagos, Nigeria, respectively, through seed funding received from Rising Scholars, formerly Author Aid. The SRN is a community of practice established to support the production and use of systematic reviews and meta-analysis in low and middle income countries. The network aims to bridge evidence gaps in low and middle income countries and transform lives by guiding decisions with robust, context-specific evidence. Now I'm going to share with you our upcoming workshop for the rest of the year. We have one on the 4th of December. It's on meta-analysis and interpretation grade assessment. And then we have a series on the 5th, 12th, 19th of December. It's a free workshop on conducting the systematic literature search. Both workshops are free. So we hope if you're interested, you can join. Now, I'm just going to share with you, you have received this in your email, the certificate criteria. To earn a certificate, you must actively participate and meet the following requirements. 1, live attendance is worth 30% of your total marks. Group activities is worth 20% of total marks. Formative assessment, module assignments is worth 20% of your total mark. Summative assessments, final course exam is 30% of total mark. The certificate of completion will be awarded to participants scoring at least 80% overall. Certificate of participation will be issued to those who do not meet the 80% requirement. Also, I want to share that for the peer review process, if you are given a name to peer review, that person you reviewed not necessarily be the same person who will be reviewing your work. All right, so if you have any further questions on that, you can contact your SRN contact person or post it in the Getting Started with Systematic Reviews chat group that we are all part of. So now let me introduce you to your facilitator. Dr. Leonard Uzairue is an academic with a keen interest in medical microbiology and public health, particularly in antimicrobial resistance, pathogenesis, immunology of infectious agents, and data modeling epidemiology. He is a recipient of the NIHR and RSTMH joint grant for a study on the impact of COVID-19 and infection prevention and control on AMR in Nigeria. His research has led to several peer-reviewed publications in reputable journals. Previously, Dr. Leonard served as the lead molecular specialist at the International Foundation Against Infectious Disease in Nigeria. He also acts as an academic research advisor for the Young Medical Laboratory Scientists Forum of Nigeria. Passionate about research capacity development and AMR, he actively contributes to advancing knowledge in these fields. Leonard is currently a lecturer at Staffordshire University, where he teaches biomedical science modules at levels 4, 5, and 6, fostering student learning and development. His academic responsibilities include 1, supervising student research projects and guiding them towards successful outcome. 2, developing engaging teaching materials in clinical microbiology and infectious diseases to enhance student understanding and interest. So without further ado, I would like to call upon Dr. Leonard Uzairue to present. So I'll stop sharing my screen.
Hi, everyone.
All right. See you.
Yeah. Can you hear?
Also, I know she's running away from us. Anytime I catch her, I will send her to boot. So she's running now.
Hello. Can you please mute your mic, everyone, if you are not speaking?
I mean, going. Look.
Doctor.
Okay. Yeah, please, can you hear me?
Yes, we can.
Okay, good. Okay. I just want to quickly make some quick correction to, I think after they got that, there has been some few changes. So I've left University of Staffordshire, so I'm no longer with University of Staffordshire. I'm now with De Montfort University. So I just need to quickly clarify that. So also, I've also taken additional responsibility after then. I also currently work with the Health Research Authority in UK as part of their ethics committee member. So just basically. So here today to make a presentation, although I think this is the second time I'm making this. No, this is the third time because I've done quite one of that, but what you're going to be seeing today is going to be a bit different from what we've always seen. So I want to welcome you all, and I want to appreciate the SRON for inviting me to make this presentation, to also be involved in this training. I've been involved from the very inception, from 2022, when the program started. And I'm very pleased to be associated with the organization and continue to engage to ensure that we have community where early career researcher within the low and medium income country are equipped to become experts in systematic review, because evidence synthesis and evidence generation seems to be what the future looks like, because especially in developed country, for example, before policies are made in parliament, or especially if it's regarding businesses, regarding key changes, there's usually need for an evidence, that what we refer to as rapid review or a systematic review, as the case may be, because whatever decision that the government is making or any organization, so to say, have to be rooted in evidence. So basically, that is the reason why we are here today. So I'm going to share my screen now. Then we'll start up with the training. I would also appreciate if we'll have mics that are a bit muted because of noise. So, like I've mentioned, my name is Uzairue Leonard Igodalo. I teach, just disclosure, I teach and also research at university, the Montfort University in Leicester. I'm also a research group, early career group leader, especially in the AMR and the group development. I'm equally a fellow of the Institute of Biomedical Science. I'm also a member of the ethics committee of the Health Research Authority in UK. So I need to make those disclosures. So my job here today basically is to look at how we can develop a robust eligibility criteria for an efficient study selection process for systematic review and meta-analysis. And I'm very sure that, prior to now, you must have come across what systematic review means, with the difference between systematic review, scopy review, and what elements a systematic review needs to have for it to be involved in meta-analysis. So just to lay a background to what we're going to be doing, so I will just quickly look at. So when we talk about systematic review, what are we talking about? Now, systematic review is a kind of a study, a review that has to be very, very comprehensive as done in a systematic way. Now, from the word comprehensive and from the word systematic, it means that from the point of identifying, selecting, appraising, and synthesizing all the evidence that you need to do has to be done in a systematic way. So it means that if any element of this aspect is lacking or is not done in a comprehensive or in a systematic way, you cannot say to have done a systematic review. Probably at most, you have done either a narrative review or a scopy review or just a literature review, because for it to be a systematic review, it has to be a comprehensive, it has to be done comprehensively, it has to be done in a systematic way. And this being done in a systematic way or in a comprehensive way has to be involved at the point where the studies that are that you are going to use were identified, how those studies were selected, how those studies was appraised, and how you end up synthesizing those studies is very, very important. Then when we talk about there are key characteristics that, for example, every systematic review is expected to have, like I've mentioned, that, for example, for every systematic review, which is now becoming very relevant, it must have a predefined protocol. Now, you can't be doing a systematic review, said to be doing a systematic review, and you are only developing it as it goes. Yeah, there are changes can occur when you're doing a systematic review. Now, the protocol, there have to be a defined protocol, which make it now very necessary for you to have to pre-register the protocol you are using, whether in Prospero or in any other kind of registration body for a systematic review. Now, the reason why that is important is that even when you need to make an amendment, when you need to alter the protocol, you also have to go back to the registration body and where you register the systematic review and alter that process, the protocol there. And I must also be very clear with all that, especially now if you have to publish your study in a very good and renowned journal, they require a pre-register number. Then also, it has to be done, the search has to be done systematically. You can't just decide on how you do this. And doing this in the sense that your keywords have to be systematically designed. It has to be comprehensive in terms that for example, if you are talking about AMR, for example, there are a lot of synonyms that are associated with AMR that is expected that you're supposed to include in your search. Because if you just use AMR, for example, without using those synonyms, what you end up having is that you have a very narrow search that you might end up missing out some study. Then also the eligibility where we're going to be dealing on today has to be done in an explicit way. The criteria has to be specified, and this specificity of this study has to be put in context in the sense that you have to make sure that the eligibility you are designing is able to make sure the study you are including are specific and they are sensitive. We are going to get there today. Then in terms of appraisal, which is not what I'm to look at today, you also have to design that in such a way to make sure that it is done. And you have to also make sure that every way you synthesize your studies in terms of extract your study is done in a systematic way. also. So now the reason why these processes are important is because this will ensure that whatever you're using, whatever outcome you design is reproducible. Because if what you do, for example, you do a study in a particular location, and that same study is given systematic review, is also given to another individual or another group to do with the same time frame, with the same population, you should end up having the same outcome. So when we then talk about meta-analysis, this is the statistical aspect of a systematic review. So it therefore means that it is possible for every study. It's not possible for all systematic review to have a meta-analysis, but all meta-analysis will always have a systematic component to it. So that is very, very important. So it means that there are some specific criteria, requirements that studies are expected to make, to have, for them to be able to come to the point of you to say you want to do a meta-analysis on them. So there are some things that, for example, you can't do a meta-analysis on just a single study, or just it has to be 2 or more studies before you can look at a systematic review. And the outcome you will measure it have to be in the same. For example, if they are not in the same unit, you have to convert to the same unit for those in science. Then it therefore means that the estimate you are trying to look at has to be the way the studies were done, individual study that you are including was done, have to have this very good similarity for you to arrive at that point. Now, why do you think systematic review is important? I'll just quickly go through them. The first one is because this will give you the highest level of evidence for informed decision making, like I've spoken about at the beginning, be it in healthcare, be it in policy, be it business, be it in government. These are very required. That's why you see that in some developed country, what you usually have now, you see they will usually have a commission. For example, if you also be following Lancet, for example, Lancet journal, see that there was a study that was done of recent on AMR that was a Lancet commissioned study. And what that study was meant to do was to produce evidence regarding estimate of infectious bacteria diseases that are associated with AMR, and how they are associated with maternity, that is associated with mortality. So it is very important you know that systematic review and meta-analysis gives what the highest level of evidence for you to be able to make an informed decision. So also it can also help you to resolve inconsistency between studies. Now there might be for example, a study can say that this is outcome A is correct. Another study can say outcome B is correct. But at the point of when you pull all the studies that I have looked at the subjects, let's say the issue of let's talk about deforestation, for example, being associated with AMR. Let's say some study can say that, okay, there's no association between deforestation and AMR. Then another study probably that was done in Africa can say there is. Another one that was done in Australia can say there is. Another one that was done in America can say there's. We are not really sure. Now, for you to be able to come to the point, what do? You pull all these studies together that have been done in several places and look at what we refer to as pool effect. Now, once you are able to now bring this together, you can have a result that will give you kind of an outlook of what the risk situation is. Now, the inconsistency in each of these studies that we are looking at individually will be taken care of when you pull them together. So that is also important. You know that, for example, another advantage here is because if I do a study, let's say I use 5,000 subjects to do that study, and you do another study in another location, and you use, let's say, 2,000, do another study and use 5,000. Now, individually, my sample size will be reporting only what I have. But by the time I pull off the result to the study that I have done, he has done, B has done, C has done, then we end up having a very large population. And you know that there's what we call sample size effect. So once you pull, you have a pool of samples, a large samples together, the outcome that you're going to generate there is going to be better than what you have if it was just an individual study. So it also increased statistical power, like I've mentioned, in terms of population size. Then it can also explore subgroup analysis. For example, probably maybe age was not because of the sample size I have. I was not able to explore age as a factor, or gender as a factor, or location as a factor. But by the time I pull all of this together, all the different studies together, I can end up doing kind of a subgroup analysis to see the effect of the different subgroup within the whole population that I'm looking at, whether be in business, for example, looking at realty kind of business, looking at conglomerate kind of business, looking at study that normally, if I have to look at them just singly, that is going to be, I will not be able to arrive at the point of having a good outcome. Then it will also have we can also end up looking at this, and at the point of the day, we have some good example. But because of time, I will just move to forward. Is eligibility criteria of a study important? Can anybody just unmute and say, okay, this is what I feel why it is important. We have a very good eligibility criteria of a study design in a systematic review. Anyone?
Let me try.
What do you say?
Let me try.
Yes, sir.
Okay.
To identify studies which are similar.
Okay. All
so
right.
that you can have good conclusion.
Okay. Boaz's hand is up.
I think it also helps to know which studies to be included in the review and which ones should be rejected.
Okay, great. Any other one before we move forward? Okay,
yes.
I think I'm seeing the prof hand. Okay.
Yes. In case another person would like to repeat that work,
yes,
it is good for the person to know why some studies are included and why some are not
included. Yeah, for reproducibility. Yes. 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 Thank you,
good
Prof.
to know what really happened.
Yeah. Thank you, Prof. Christopher.
Yes, so it also helps to delimit the study to a certain scope so that you don't get articles outside the scope.
That is very, very important, because if you don't do this, what you end up, by the time we're going to be looking at the specificity and the sensitivity of selection, if you don't do this, you can only abide by a specific selection process, and also a sensitive search based on the criteria you've set. Because if you have a very poorly designed eligibility criteria, you might end up having to do so much labor. For example, we're going to get there. Let's assume I want to talk about stress, for example. And I just say, okay, I want to look at factors that affect stress. That is a very broad term, because there are a lot of things that could affect, that could make someone to experience stress. But if I want to come to the point of having a very specific factor, then I may have to come to the point of what? Of having a very slim eligibility criteria. Let's say I want to look at factors that are associated with workplace. I want to look at, example, effect of mindfulness on stress. Those are specific things that you are looking at. But when you just measure factors, you have to be very careful to be sure that you have specific things that you are looking at. So the first thing here is that it helps you to focus and help you to have relevance. Now, why this is important, if you have a well-designed criteria, now it ensures that the answers or the questions you are trying to provide answers to will be specific. You have a very specific research question. And what will this help you to do? It will help you to limit your search terms, to help you to be specific about the kind of inclusion, the population you're going to be focusing on. It will also help you to look at, to be able to determine the kind of studies that you're going to include even in your study. So this is very important. It helps you to focus and to maintain relevance. So that is very, very important. Another thing that happens here is that it also helps you to maintain, minimize bias. Now, if you don't have a clear-cut criteria, what you end up having is that you might end up having a study that is biased. But if you have a very well-designed eligibility criteria, you limit the risk of selection biases. For example, you are not going to be the systemic difference between studies that you did not include or that you are not supposed to be included will be drastically reduced. That is also another very important thing. Then, like Prof said, validity and reliability. Now, if you don't have a very specific eligibility criteria, your study will not be, you can't really validate what your study, in the sense that it cannot be reliable. Because if I can't reproduce your study, if I can't take up your study that you have published in terms of systematic review, I do the same search that you used. I use the same database that you used. I apply the same criteria you said you have applied, and we don't end up at the same time frame that you did your search. And that's why you must report all of those things even in your study, because you need to report the time frame you search, need to report the database you use. The reason why this is done is because another person can take up the study you've done, reproduce it, and have almost the same result, if not the same result. So that is also very, very important. And why this is also because internal validation and external validation will also is very important. Because if you, for example, I'm also an editor for 2 or 3 journals. Now, if I receive a systematic review, what I do first and foremost is to take the search terms that you say you have, pull it up onto, I may not go through all the database. If you say you use PubMed, for example, I'll take up the search term that you've designed for PubMed, pull out that search term into PubMed, and use the same time frame that you said you used. If I don't have the same outcome you say you have, now I'm already beginning to query what your result is. So that is very, very important. Then I've mentioned reproducibility. So if you don't document, or if you don't have a very good eligibility criteria and selection criteria, you end up having a study that is not reproducible and that cannot be replicated. And in science, as we know, replication is very, very important, in the sense that that's why even when you are doing experimentation, they will tell you have to replicate. Although in some health sciences that might not be possible, but if you are doing things, for example, in the laboratory, whether in biochemistry, microbiology, those in experimental like physiology and the rest, you must do the same. Also, even in businesses, that's why sometimes they will also ask you to you have to take even opinions of people over a period of time to see what the outcome is going to be. So reproducibility is very, very important, because this will only be possible if you have a very good eligibility criteria that you've set out to produce. So the next is efficiency. Now, if you have a very good eligibility criteria, what this will help you to do, it will reduce the burden of screening. Now, if you have a very sensitive search, I'm going to get there now. You have a very good, if you have a very sensitive study, what you end up having is that you're going to have so many articles on that study that it will take you a whole lot of time for you to screen them. But if you have a very sensitive, a good sensitive and a good specific study, what you end up having is that you have study that is focused and that is relevant. Now, but if you also have a study that is very, very specific, what you end up having is that you end up having studies that are very relevant, but you end up missing some study that might not. That's why you must make sure that there is a balance. There should be an equilibrium between sensitivity and specificity when you are designing your eligibility criteria. We'll still get there. So what then happens if you don't have a good criteria? Now, just usually you end up including as many irrelevant studies and therefore diluting the findings. So that is one. The next, and why this is so is because if your population or study that you've designed is not specific enough, it's not, you've not been able to really include the right population, what you end up having that you end up having an evidence that will end up not being usable. So that is a very big factor. Then the next thing is that if you also have a very poor criteria, you end up missing out key studies that are supposed to be relevant, and as such, you end up having a study that the conclusion will not be conclusive. You have incomplete conclusion. I'll give you a very good example here. There is a study that we did, although it will soon be published. What we did, someone has worked, it's a systematic review. Someone else has worked on that study before. Then we decide to look at it, and one of the we actually sent it to a very, very, in fact, I think one of the top 2% of the journal. And when it came back at the first round of review, what the reviewer pointed out was that the study has been done before. He even attached the person's the study that, okay, we should justify why we are doing it. And do you know why we actually do that study? When we looked at the study, what the person, those group of researchers did, how can you be doing a systematic review and you just end up only using PubMed? So it was only PubMed that they used to search what the outcome of the study that they did, and they even called it a systematic review. The another thing was that how they also do their data pooling, and because of that, we use that as a justification of why we needed to do the study, because, and this study was being done in Africa. It was supposed to be done in Africa. Now, just imagine that kind of study, a database that you did not use Africa Online Journal. There are a lot of outcome that study that you miss out from that study. The reason is because not every study, for example, that is published by researcher in Africa make it to PubMed. There are some very good journals. There are very good studies that have been done that were published in, for example, maybe institution-based journals or society-based journals that are not yet indexed in PubMed. And as a result of that, if you end up just using only PubMed, what you end up doing, for example, is that you end up only including studies that are probably very positive outcome study, why there might be some negative outcome. It's actually now that journals, editors in journals are beginning to be receptive to negative result. In the past, what editors are just interested in are studies that are positive, that have positive outlook, that have positive result. And that's why you now see that there are even some preprint, for example, that are advocating that if you have a negative result, please bring it and get it published. Now, there are journals too are becoming to be researched in as much as you are able to justify why it is like that. So that's why you must make sure that when you are doing study, for example, in Africa, you must make sure that you include some specific database that may not make it up to, that some studies that are done in Africa may not have made it up to some very big databases like Scopus, Web of Science, PubMed, and the rest. So that is very, very, if the reason why this is important is that if you don't do this, you end up missing very important evidence, and the result that you likely have will be incomplete result. In as much you make your conclusion, but if someone else take up that study, it can puncture, see way to puncture and actually say that that study is not as it should. Then lastly, you also end up having a subjective selection, introducing bias and reducing trust in the result. So if you, for example, there is a very good evidence that you do not include, if I'm a reviewer, for example, what I usually do is that if you send if I have an article from you, before I send it out for peer review, to invite peer review viewers, I first and foremost look at, okay, what studies is who have you included the study that are supposed to people that are supposed to be experts? For example, when you're talking about diabetes or diabetes treatment, there are specific studies, for example, that if editors don't see, they begin to know that you've not done a very good search, because there are some studies that the subject you are looking at, that it is expected that because of the level of evidence that this person has produced, it also is supposed to be in your literature. It's not that it is trying to have those people being referenced in your work, but it's as a result of they become an authority and they've been able to have some kind of credence to what they are saying. If you're talking about, for example, nanoparticles and all of those, there are some people that have done essential work in those areas that it is expected that it should be there. So if we are not saying it, then there's an issue. Same with business, for example. There are people that have become authority in quantitative business studies or qualitative business study that, if, for example, you're talking about theory or phenomena, that if you don't include such people in that study, there is usually an issue. So now, the foundation, for example, for eligibility criteria is usually gotten from PICO. Now, there are a lot of other kind of framework that are used in business, that are used in social sciences, that are used in agriculture, that are used in psychology and the rest. But the foundation from where every of these are designed is PICO. And you know that PICO mean is what is usually widely used to design your research question and your eligibility criteria. So when we talk about PICO, what it simply means is that we're talking about population or participant, we're talking about interventions, or we're talking about is there control, is there comparison, the outcome that we're looking at. We're also looking at study design, and the variation that comes in. In some cases, study design is not even there. Then there are other variation that comes in. For example, it has to do with the time frame. It has to do with the context of how the study was done. A lot of other things that can be included. But for the purpose of this study, I will be focusing on PICO, but I will apply to both in those in social sciences, in sciences, so that we have kind of, because I know that we have an audience that is not just only science focused. So now, this talking about medical science, for example, when we talk about an eligibility criteria, now it's like a funnel. You know, each of us, I'm sure that everybody here have seen a funnel, especially if you are in Africa, where we have to buy fuel, then you also have to use probably transfer liquid from the other. No, that's how a funnel is. You notice that depending on the kind of funnel that you have, this will determine the kind of what the amount of liquid and the speed to which the liquid is dispensed. So that is also how a criteria of a systematic study is. Now, you need to have a very good funnel. Now, at the very beginning, you'll see that if you look at here, if you can see my, can you see my cursor?
No, please.
Okay, sorry.
Yes.
Okay. Okay. I'll just I'll just try to see if I can annotate.
I can
So,
see.
Yeah, we
okay.
can see the Keza. I don't know.
Okay. That's good. So what I'm saying is that if you look at this funnel, this is like different layers. You can see different layers. So at the upper layer, you can see that it can take as many. I want to use this now participant as possible. Same also, if you see as it goes down, what happens is that you can see that it becoming narrower. That is how your selection should be. Now, if you have a very good search, you should have this kind of funnel, meaning that at the point of article, what is it called? Title and abstract screening, for example, you should have eliminate as many studies that are not relevant as possible. Now, as you move down, you see that it begins to narrow down. So that's how your funnel. And at the end of the day, most studies that should be included in your study should be studies that are very, very relevant. Now, in terms of non-medical science related, we also have almost the same thing, but we are going to see some specific examples in this case. You see that is how your funnel should be, your criteria should be. It should be something that is done in a way where at the end of the day, every study that you are including is relevant. And even those studies that are going to be, if you have a very good search terms, most study that you have here will be almost study that that are supposed to, they will have some relationship, a similarity to study that should be included. For example, if you are doing a study on let's say a particular biomarker on the upper respiratory tract infection, for example, and you did a search, you have that biomarker, and the way, depending on how you did your search, and when you're screening, you are beginning to see diabetes there. You know that it shows that there is an issue with that search, because, or for example, you did a study, you are seeing something in psychology and all of those. The search was not properly done, so that can be a factor. So let's look at each of these criteria that we've talked about concerning population. Now, the first thing that we usually have when we talk about population, the question that I purposely did this in form of a question, so that when you are doing your study in the future, what you will always want to look at is basically trying to ask these questions similarly. The first question is that, who are you looking for? Now, that is the participant, or what group are you interested with? Now, I purposely choose just two examples. I use something in science, then I use something in business. So we can always also talk about social science if there's any need. So, for example, if you're talking about who are you looking for, now, are you only letting people between the age of so and so as your population of study, or is talking about event, for example, is the event or whatever study, is it for every individual or is just for some specific group of people? Now, if it's also for another question that you want to ask yourself is, who are you looking to influence or to understand? If you're talking about business, for example, what aspect of the business are you trying to understand? What influence are you trying to understand? Are you trying to understand influence in certain aspect of business? Or, for example, are you trying to understand some social construct? So those can actually make things that, for example, that you will be looking at as population. Which disease are you studying? If it's health, what individuals are involved in that kind of study? And I want to note here that a disease can be a population. The people, some group of people can also be a population. Then equally, a particular target too can also be a population. So, for example, if it's a business, are you looking at individual customers, or are you looking at an entire organization, or or a specific market segment. So now, if you're, for example, you're looking at a study that involve human participants diagnosed with type 2 diabetes, see that specifically here, we're talking about humans who are diagnosed with type 2 diabetes. So it means that if you are doing your study and you just put humans, or you just put type 2 diabetes, there is possibility of, for example, having studies that are done in animal studies, that animals where the participant were like the experimentation, what was used as experiment subject. So that is one. Then in terms of business, for example, are you looking at small scale or large scale enterprise in a retail sector, or in the public sector, or in the non-governmental sector, or in the social enterprise sector? So those are some of the things that you should always ask yourself when it comes to this aspect of population. At the end, there is a task that I've designed in form of a game that I want us to be involved with, and you will come to understand specifically what I'm talking about here. So the next one is intervention. Now, intervention is like, what are you trying to study? What is the main event? What intervention are you looking at? What exposure are you looking at? Are you looking at intervention, or you are looking at exposure? In terms of epidemiology, if you're looking at intervention, or you're looking at exposure, those can also be it can stand in point of, for example, if you're looking at exposure, it could be exposure to people who are exposed to cigarette smoking, for example. That can also stand in form of an intervention as compared to people who are not smoking. Or intervention could be people who, there's this study in Nigeria, for example, that was recently, I think it's funded by Gate Foundation. It's headed by a professor in University of Lagos. I think it's been done in, if I'm correct, it's been done in Lagos, and it's also been done in Kano. It has to do with the kind of supplementation of pregnant women during their pregnancy with iron and some other vitamin, trying to see how the outcome. That is an intervention study. You are trying to intervene by introducing a supplemented, maybe a supplemented food, or a supplement or iron supplement at the point of pregnancy. Then you will now begin to look at certain outcome, which we are going to look at. But in terms of business, we are trying to look at, for example, what business strategy or intervention are you evaluating? So that is important. Are you looking to look at, for example, the impact of a new market campaign for people in business, or for people in social science, for example? Are you trying to see, this is very important in social science, when you introduce a kind of intervention, an educational intervention, for example. Let's say in the community, you are trying to look at how education can influence AMR, for example. You can have a certain group of people, train them on AMR, then they are probably in another society, another community or group that were not trained, then try to compare an outcome at the end. So those that you have trained, the training is the intervention you are introducing to those set of people. And in terms of sociology, you can also try to look at a certain intervention on human behavior. For example, the using of the taking of self-medication is a human behavior. Now, education can be an intervention that is designed to try to measure how this intervention, how this social construct or social behavior can be changed. So there could be a comparison trying to look at different educational training. For example, maybe the use of games, the use of television, the use of different media to do those kind of intervention. Then you cannot compare them. So intervention has to do with the kind of what you are trying to do to change whatever you are trying to look at for, to see if the outcome you are looking at, if it's influenced by that intervention that you are bringing in. So a very good example could be, for example, study where participants are receiving a specific medication. For example, in the very old time, this was a very good drug that was used in for diabetes mellitus, which is metformin. Now, another intervention could be lifestyle intervention. For example, the eating of a low carbon diet, or for example, the exercise. You can try to see, okay, if exercise is going to improve certain outcome in the diabetes patient and the rest. Then for a study, you try to look at, for example, whether the adoption of a particular e-commerce platform, if it's going to either increase sales or decrease sales. So that could also be an intervention. So that is also one. So comparator, like I've mentioned, this has to do with what you're trying to use to compare, trying to see what you are trying to compare the intervention again, whether the normal how things are done being the standard, then comparing it against an intervention. So a comparator can be the standard that is known as compared to an intervention. So this has to do with something either that is standard or something that where there is no interview, or what in science we refer to as placebo. But in this, for business, it could be trying to see whether those that adopt e-commerce compared to those who are not using e-commerce. So those who are not using the e-commerce become the comparator that you are using. So this is just an example. Because of time, the outcome have to do with what you are measuring. So what are you trying to measure at the end of the day? So when you are designing your study too, you need to look at, okay, what am I measuring? What outcome of interest am I trying to look at? Am I trying to look at, for example, improving blood sugar for a diabetic patient, that the glucose level of the, let's say at the time of before the intervention, the person glucose level was probably 7 point something milligram per DL. Then after the intervention, is it going to reduce, or is it going to remain normal, or probably is even going to increase? So that's the outcome you are trying to measure at the end of what you the study measured is what is referred to as intervention. In this case, since we are looking at a systematic review, so you need to make sure that why this is very important here is, if you're doing a study and you're trying, especially if it's going to involve meta-analysis, for example, the outcome of interest must be present in every study that needs to be that you're going to be included in the meta-analysis section of it. That's why I mentioned at the very beginning that not every systematic review have a meta-analysis component. Now, what usually discriminate, or what usually you use to discriminate or differentiate between a study that we include a systematic review, or a study that will not include a systematic review, is the homogeneity, or homogeneity or homogeneous nature of the outcome that you are measuring. Now, if the study is very heterogeneous, meaning that the outcome varies, there's no how you can have a meta-analysis in that case. But if the outcome of the study is kind of monotonous, in the sense that it is just only one outcome that you are looking at, that is present in every study. For example, let's say you're looking at prevalence. You're looking at prevalence of a particular, let's say, of a particular event, and it is present in every study. Now that can qualify for a meta-analysis, a pool prevalence study. But if that is not present in every study, then there's no how you can measure that. So in terms of business, trying to look at sales growth. For example, if all the study you are looking at measure sales growth, they look at customer satisfaction, they look at employee retention or market shares. So those can be outcome. Then I also need to note, I want you to note here that it is possible for you to have more than one outcome. But most often, what you usually have is that you have a primary outcome, then you have a second, you can have, then have even several secondary outcome. I will give a very good give an example. Example is, for example, when you're looking at, let's say you're trying to look at urinary tract intervention, let's say guideline in countries, for example. So it is possible for you to want to check the primary outcome can be, for example, adherence to a particular guideline, maybe for a particular disease or the treatment to a particular disease. Now, a secondary outcome could be here that how is the diagnostic framework be, but your major outcome is prescription, for example. But a secondary outcome can be, is there differences in how prescription is made to a particular population as compared to another population? But your main outcome is trying to look at adherence. So that is a very good example. So for a health study, it could be when a study is reporting blood glucose level. In this case, there's several ways where blood glucose can be reported. It can just be fasting blood that you are reporting, but it is possible that the main outcome that you will be measuring is, for example, the HbA1 of that, which is a very good marker, although there are now studies that are also querying that. Then it could also be that you're looking at the body weight. You're looking at cardiovascular events, which is not specific, because if you just say category cardiovascular event, there are a lot of things that have to do with cardiovascular event. So another thing can also be quality of life. So it therefore means that study we have to use quality of life score to be able to arrive at the outcome that you're looking at. Now, in terms of things that are not medical related, we will be looking at, for example, the sales revenue growth over a particular before when you adopt that particular intervention as compared to before you adapt it. There's customer acquisition, retention, cost, online conversion rates, market reach for those businesses that you are trying to evaluate. Then lastly, we look at, this is usually optional, but it is, I think now, I think recently from Concrete, this is becoming important, because if I do a study and I end up using quite a lot of randomized clinical trial or randomized trials, the evidence that I'm going to have there is going to be better compared to if I include randomized trial, observational study, cohort study, and a lot of other case control study and a lot of other kind of study. So this is also another aspect that is now becoming important. Why this is important? This will also help you to reduce, to be specific, and to maintain focus and relevance and specificity, in the sense that if, for example, you are doing a study, let's say trying to look at intervention of a particular drug, it is expected that most things that you should include in that kind of study should be studies that use clinical trial, that use clinical trial, that are randomized. So if there are no study that, if you report studies that use both randomized and non-randomized, the outcome is going to be different from a study or someone else that use just only randomized trials. So that is also very important. So the type of study you are including is also very, very important. Are you including a mixed method study? Are you including only just qualitative or quantitative individual studies and surveys? So this is something that is also very, very important. So as an example is if you are including a randomized clinical trial study, or perhaps just you're only going to include, or you're also going to include observational studies like cohorts or case control studies, that could also be an issue. Then for a business, it could be, are you going to use only just a quantitative study, which in this case, we are talking about an empirical evidence, studies that use quantitative data, for example, surveys, financial analysis, or a quasi experimental design, or it's just going to be only a qualitative study. Probably it's going to be a focus study that use focus group, that use co-creations, that use in-depth interview, or that use just basically a quantitative kind of study, or just a study where you have to observe what is happening within that organization. So those are some of the things that you need to bear in mind. So just before we go from here, there are some other things that you might want to also include in your eligibility definition. Could be trying to look at the language. Now, if I'm doing the study and I'm not including, I'm only just using studies that are only just done with English language, then I need to declare that this study is only done, the study that I'm including is only done in English. So that is very, very important. So you also need to consider the publication status of the study you are including. Has it been peer review, or they have not been peer review? Are they just abstract? Are they dissertations? And are they conference, or they are peer reviewed journals that have been published? And that's why the issue of, depending on the kind of study you're doing, for example, the issue of the use of grade literature then comes in, because there are some studies that you're doing that it is expected that you should include grade literature, because that will enrich your argument or whatever conclusion that you're going to make, as compared to when you use only just published study. Then time frame too, like I've mentioned, is also very relevant. Trying to know, for example, are you looking at as a particular point in time? Are you looking from a 10 years period down, or you're looking at 20 periods down, or there is no restriction on time frame? So that is also very important. Then you need to also state when was the last date you included in your search term. Then why this is important is because, for example, like I mentioned from the beginning, as an editor, if I'm to look at your search term, if you say your last search was in August 2025, August 31st, 2025, then I can therefore search and stop my and make sure that my end search is within that same period. So if I do that, I'm supposed to also have the same outcome as you have, as compared to if I don't use that. Like lastly, settings is also very important. Where is this study based on? Was it done in Africa? Was it done in certain population? Was it done in certain location? Was it done in at a particular season in time? Then context also matters. How was this study done? Who were this study done? How was this study done? You know, that will involve around, depending, especially people that are in social sciences. This is very relevant, because the context, social scientists are usually very interested in the context of what is whatever phenomenon they are trying to measure, because they need to understand the context to which they are defining, or they are arriving at the conclusion that the study arrived at. Because if the context differ, then the similarity in the study would have been distorted to some extent. So that is also very, very important. So I mentioned at the beginning that the issue of specificity and sensitivity is very, very important when it comes to eligibility criteria and even study selection, in the sense that how well the criteria include. When we talk about specificity in a systematic review, what we are basically talking about is how well does this study is able to exclude irrelevant study as possible. Now, a highly specific criteria, for example, will usually lead to a fewer irrelevant study, but may miss some relevant ones. Now, why a sensitivity of a study is how well the criteria include all relevant studies. So highly sensitive study will capture more relevant study, but may also include more irrelevant study, increasing the workload. Now, if I am to choose, for example, between a study that is highly specific and a study that is highly sensitive, now, depending on the situation, will determine what will you do. Now, during COVID, for example, now the issue of sensitivity was kind of reduced. It was more of specificity. Now, why this was done in the sense that because of the time that is required for a particular, especially in a government setting now, the use of social distancing, the issue around the use of mass, of using pharmaceutical and non-pharmaceutical intervention. Now, if you go back and look at systematic review, the very early systematic review that did those studies, what they did was just that they tried to make their study as specific as they could. And why this is done, because of the urgency of the need to get evidence to do what to guide policy of government. Then also it could also be lack of manpower. Now, if you don't have let's say it's just only 3 people doing a systematic review, if you make your study to be highly sensitive, the workload will be very increased because you have more article to screen. But the beauty about this is that you are able to capture as many relevant studies as possible. So usually, what I usually say is that try to trade. There should be a trade-off between sensitivity and specificity in your research. So what you should always try to do, make sure that you balance this on the research question and available resources. So if you have many individuals involved in your study as possible, make your study as sensitive as you can. But if you don't have as many people in your group as possible, then you need to then make it as specific. Then you need to define all of those in your reporting. And why this is important, because you need to state all the steps that were involved, and at the end of the day, you are able to arrive at this. Now, example, I just gave some specific example here. Now, example is a randomized clinical trial of cognitive behavior therapy delivered face-to-face by a certified therapist for adults with primary diagnostic of generalized anxiety disorder. Now, you can see that here, it said this may miss online CBT or CBT for COVID conditions, because you can see that this is very specific. It said it has to be a randomized control trial of cognitive behavior therapy that must be delivered face-to-face by a certified therapist for adults with primary okay. I think someone, am I almost at the point? I think, Julia, any consign?
Yeah. Yes. I just want to ask how much more time, because
we are almost through. Yeah. So
how much time? About 3 minutes again that you have, or so we
okay,
have the question answer section and group activity to do as well.
Yeah, of course. I think I'm almost at the last slide. Then after this, I will hold on for the activity, which we can just look at together too. So
okay,
basically,
thank you so much.
Yeah. So studies evaluating psychological intervention. Notice that it just mentions psychological intervention. So this is very sensitive because there was no specific intervention that was mentioned. So that is an example. So lastly, what you need to make sure that you do, make sure that documentation of your eligibility criteria is very, very important. You make sure that you are as clear and explicit as possible when you are designing your criteria, and also make sure that you avoid whatever you're doing, and in all, make sure that you are transparent and make sure that you have a good documentation that will make your your study reproducible. And one of the way through which you do this is by making sure that you register your study either on Prospero, and I think there's quite a lot of other, but probably actually more tend towards Prospero. So I'll stop now. So these are just things around how to move around from criteria to selection, which is not just very simple. Make sure you after screening your database, you move them to the video, do your extra screening. I think all of this should have already been spoken about, although it's not supposed to be covered in this session. So this is just how Prisma Flow should go. You have access to this slide. So I will stop here, then we'll come back to this channel. So I will take questions, then we can come and look at these tags that, there's a tax at the end that you will do on your own, but there is just a few tags, kind of a game that I want us to look at before we go to that actual tag. So I will stop here and I'll stop sharing now. Then if you have any question, then I will take your question.
Okay, Dr. Leonard, there's 3 questions that were in the chat. One from Mr. Boaz. He asked on the I in PICO, right? Intervention per the example you gave on AMR trained and untrained community members. Which studies should be included? Only intervention studies, or you can include cross-sectional studies? Which other studies can be included if allowed?
Okay, thank you. Now, you need to understand the context. Now, when we just say intervention now, what are you trying to measure? Like the example I mentioned on trained and untrained, I said the outcome will be to try to look at, to try to check if it will enhance, let's say, knowledge, for example, or reduce misuse of antibiotics. Those are the outcomes that you want to measure. Now, if you are trying to look at studies that, if you are doing a study, let's say you are doing a systematic review to try to check the impact of training on, let's say, on misuse of antibiotics. Now, this kind of study that is expected for you to include, it has to be studied that is around that have both arms. It has to be studied that either have a case control study or a randomized control study. Now, cross-sectional study might not fit in because for cross-sectional study, you are not really measuring impact. You can't measure impact in cross-sectional studies. So it has to be either a randomized or a case control or a cohort study in some case, but it's more of a randomized and a case control. Now, why do I say randomized? In randomization, you randomize the training between, let's say, 4 communities. A community is trained, another community is not trained, or some are. So then at the end of the day, then you end up trying to check the impact of the training on those as compared to those that was not trained. You measure the outcome from both sides, then you will be able to arrive and say, okay, this educational this AMR education have impact on misuse of antibiotics. And the evidence was based on, because you have data from both trained and untrained group. So that is one. Then for a case control study, that's the same thing. You also have the case, those that are, for example, that are, in this case, it's more of an observational study. Probably you look at retrospectively, let's say there is a community where it has been said that a lot of people, there is reduction in antibiotics use there, and there's another community where there's overuse. Now, what you try to do is that you try to go back, for example, and check within those community what might be the reason why this happened. At the end, probably you find out there is education, there is AMR education, and all of those. Then you can then report that, okay, you are trying to compare a community where there is low antimicrobial use or misuse compared to a community where there is higher antimicrobial use. Any question, please? Any other question? I hope I've cleared that.
Okay, thank you so much, Dr. Leonard. What we will do is that actually one more question, and that any other questions remaining, I will share them with you and you see if you could answer them, and it will be shared with the participants afterwards. So one last question before we break out into our group activity. What would the proxy for comparator be for systematic review where one had exposed instead of intervention?
Okay, yes. Now, if you it's just straightforward. We have exposed and unexposed. So, for example, like I mentioned, you're trying to look at a systematic review, let's say, of impact of cigarette smoking on a particular thing, outcome. I don't know the outcome. Now, being a smoker or being exposed to people who smoke is qualified to be an example of exposure. Is that okay? Now, you therefore need to look for a population which you are going to be comparing if you want to do a comparative study that are not exposed to that same outcome. Is that okay? Is that clear?
Okay, okay.
Yes.
Ruth, that question is from Ruth, and Ruth could probably put in chat whether or not that question is answered for her.
Okay.
Fortune, would you like to let us know if you are ready to do the group activity? Dr. Leonard, can you, if you have the slide for the group activity, or you like me to share it?
And no, I will share it. I can make some modifications. So.
Okay, so go ahead and
Yes.
share the slide to discuss the group activity, please. And Fortune can let us know when he's ready to put us into groups.
Okay. I think what you just do for me, you spare me. I will actually share this particular slide to the to each of them. Yes, because there's a modification I did. I will leave that available. So basically, for them to understand what I was doing, I just designed kind of 3 games basically that will help them to understand. But I'll make that available if we can actually do that. So basically, this is around social science. So this is like the criteria. You have it must be this age, you must have this so history, must have this employment status, then have an education status, then you have kind of a challenge. So this is the challenge. Now, looking at this criteria that I've said, if you look at this different challenge, then you need to let me know whether will this person be eligible or will this person be included or it will be excluded. So that's the game. So I also provide the answer at the end. So this is that. But once you have access to the slide, then you'll be able to do that. Then we have for the health related too. We also have the criteria. Then we have kind of a challenge too. Then you end up having the same what is it called outcome. So for business too, we also have that, then also have the same outcome. So you have access to this slide, then you can try to lay your hand on it and know, so that you understand. If you are able to understand, why I try to use the real world situation to design this game is because this will enable you to be able to, when you are even doing the scientific aspect of whatever you are doing, you are able to think around and say, okay, oh, this was how this game was played. So as such, this is how I should also do it in terms of a systematic review. So with that, this is the class activity.
Okay.
Over to you. Yes, over to you.
What I will do is, I'm thinking I could see if I could get a copy of that slide and share it with all the SRN contact persons, and or if any persons in the room, if you wish, you could take a picture or a screenshot on your computer or phone and have it with you during your group activity session, if that's okay.
Yeah, I think that's fine.
So I'm gonna call upon Fortune to assist in the group activity in the breakout rooms, please.
Okay, can I stop sharing?
I believe so, but if possible, could also send me those activities as well.
Okay, the other ones that I spoke about.
Yes, the ones that you spoke about with the activity.
Okay. So what I will do then, I will just stop sharing. Then I will send them over to you on the chat. I'll just screenshot them and send them over to you, so they can just discuss it in their group. Then when we come back, we can probably, if we still have some few minutes, we can try to see what their resolve. What is that? Okay.
Okay.
Yeah.
That's all
So
right. So just going to quickly read the instructions again to make sure everybody's clear. Based on your slide on the screen right now, the instructions is to use knowledge from your previous session and this session, develop eligibility criteria for the tasks you have been working on, and the task develop eligibility criteria for the tasks you have been working on. Kindly provide a brief note on the reason for exclusion and inclusion criteria set. Anybody could just give thumbs up or say in the chat that you understand what the group activity will be. And we are now going to put you all in the breakout rooms. Fortune, are you there? I've seen thumbs up. One person.
Can you hear me, Julia?
Yes, I can. Go ahead.
Okay. Just a minute. So Julia, how long
Yes.
is this going to be?
It's now 7:23. That is 4:23 right now. I think Dr. Leonard, would 20 minutes be 20 minutes or 15 minutes be sufficient?
15 minutes should be 15 should be sufficient just for them going back to what they've studied. Just try to develop an eligibility criteria for probably if they have a task they've been working on earlier. So basically.
Okay, no problem. So that's 14, 15 minutes will do well. Thank you.
15 minutes. Okay. Is it okay?
Yes,
Would it be okay if you go? Okay. I mean, I feel like if you could go over the instruction again, so that when the teams are joining the breakout room, they just go ahead with the activity and won't have to
okay. Leonard, you want to explain it? Leonard, you want to go through the instructions one more time? Are you there, Leonard? Dr. Leonard?
Yeah, of course. So I'll stop sharing.
Okay. But fortunate organizing the breakout rooms, you could go ahead and explain exactly what you want the participants to do.
Okay. It's just basically I'm sure that this is not the first you have been having other sessions. So I'm sure someone has spoken to you how to develop a topic, yes, how to do search. So if you've done all of those, I'm just saying that can you try to, based on the knowledge that you've gained in previous sessions, try to develop just an eligibility criteria for tasks you have been working on. I'm sure that there is a task probably that you've given in how to design a topic. So based on that topic that you've designed, can you try, based on what I've taught you now, can you try to develop an eligibility criteria from that topic? That's just purely the task.
Okay. Thank you, Dr. Leonard. So I'm opening the breakout rooms now.
Okay, done.
So you can just join your group breakout room.
Okay.
If you're experiencing any challenges joining, you could let me know.
No problem.
There's some hand raised, Prof. Ngozi, please go ahead, please.
Yes, I hope we will have access to our questions last time. The Google form we worked with.
Yeah, you have access.
Yeah. Everyone has
Yes.
access to their Google document. So you continue doing the group activity for the session on that same document. You just scroll down and put session 2 and you start.
Okay.
Yeah.
Okay.
So we still have lots of persons in the main room who have not joined. So if you look at the top left corner of your screen, if you're using your phone, you would see a breakout room option. Then you can just click there and join. Otherwise, if you're using your PC, I think it's at the bottom corner of the screen.
We're not seeing anything on the screen.
We are not seeing it though.
Unfortunately, we're not seeing the screen to select to go into the breakout rooms.
Yeah, I have removed Dr. Leonard from Spotlight, so they should
Okay.
see it. Using your PC,
Okay.
you can see the bottom. It should be at the bottom.
We're not seeing it. Oh, go down to the bottom of the screen and mark join breakout room. You click on it. Everyone, you see join breakout room. It's next to where you have show caption and more. So you look at it and you see your group name, select it, and you join the room. Is everybody okay now? Is everyone seeing? You click on join breakout room in the bottom of your screen on your phone or computer. And select your group name.
Julia, so we can assist those that are not able to
People are
join.
going. Yes. People are
So
going.
if okay, but if you're not able to, just let us know your group and then we can just assign it to it.
Yes. Ernest is in Washington. Ernest, you're in Washington group. Millicent, you're in Washington, DC group. Ajala, Washington.
So
Millicent,
Julia, I
you're in
might
Washington,
have
DC.
to leave the main room now because I'm supporting some colleagues in their own breakout room. So I
Okay.
don't know if you'll be able to assign participants in case there's anybody. I think we have Enes, we have Jerry, we have Fonka, Millicent, Atella. Dr. Leonard, so you can move around the breakout rooms, please, to see what participants are doing and if they need any support.
All right. Ajala says she's in Accra. You're not seeing, look on the bottom of the screen, mark, join breakout room.
So I'm going to assign Ajala to Accra now.
Right. Ernest is in Washington, DC.
Oh, Millicent.
Millicent is also in Washington, DC. Ernest and Millicent.
Yes. Okay, Enes is in Washington.
Yes, Millicent in Washington. He just went, I think, here, and Ernest in Washington. I'm not sure which room Shu is in. Let me check. Ajala
You can
said she's.
you
Let
can
me
check
see which room.
Fonka and show which rooms they should.
Let me
Okay,
check
I'm
on my
going to
group.
join my group now.
Okay. Let me check and see what group Shu is in. And then I will join my group.
Come again, what did you say?
I'm gonna check and see those person names who are not in the group to see which group they belong to. 2 persons here before I join my group. 2 persons in the room. Let me see. Yeah, so that's- Sure, do you know which your group name is, please?
Yes, I'm in Nairobi group.
Nairobi. Okay, go ahead. You could just, can you see down the bottom, join breakout room?
No, I can't see it. I
Okay.
can't see it.
You can see it. Okay, just a second. Let me see. Let me see.
Now I can see.
You can see it now? Go ahead. Go
Yeah.
ahead and join your group. Very good. The next person, Fonka. Do you know the name of your group, please? Fonka? What's the name of your group? Rokiba, did you find your group? Jokibert, are you there? Yes? What's the name of your group?
I was logged out, but I'm trying to join my breakout room back.
Okay, try to go ahead and rejoin. It could be your internet connection doing that. Go ahead and try again. And Dr. Leonard, you could always move around in the different rooms. Okay, great. Now I'm gonna go into my group. I have been in their house for above 25 years. Above 25 years. 1 million one. I mean, then they were saying whatever. Their entry with me is very high. But I look at it, things have come to this stage. And maybe if you're more as I can handle the situation. Don't know where again. You understand? At the head of the family. At their height, at those now. Already been to my door, that is very bad. Does it mean that when you see one with the dog, I said, go and I will have it. Sorry.
Now look at the children that receive prenatal vitamins and those that did not.
Stella, one moment.
With respect of congenital.
Stella, we're in the main room right now.
Hello? I didn't.
Hi, Stella. We are in the main room right now.
Yeah, that.
The setting for our work.
Dr. Leonard, sorry.
Yes.
How many more minutes? I see we have so many people still talking.
I know everybody's still discussing now, sort of trying to figure out how to do it.
I think they have not realized that we are back to the main room. Okay, Dr. Leonard, please, how many more minutes can we add for them to wrap up? We have 18 more minutes in total.
I want to, like, how long do they are they supposed to present it to their outcome for each of the group?
Unfortunately, I'm not sure. Maybe we can take just 1 or 2 presentations. So I think 5 more minutes. I don't know what our SRN contact persons think. If 5 minutes can be enough for their teams.
For 5 more minutes might be able to help. And what we will do is that if anybody in the group right now think that they could present, we could ask them after the 5 minutes. But I'm not sure how many would, because they need a lot of discussions to figure out what to do.
I think that's fine. We can give them the 5 minutes to conclude what they have. Then if we have the time, I think at the end of the, if I'm correct, at the end of all the facilitation, they are supposed to have arrived as like a semi-ready protocol. Am I correct?
Fortune?
Yeah, Julia. So I'm gonna do it for 5 minutes now.
No, I just asked a question. I said if they can't present now, I'm assuming, because I was going through each of the room and I noticed that they are having kind of a document, they are putting everything. I'm asking at the end of the training, the whole training, I assume they should have like each of the group, because each of all their tasks should be in group. So they should have arrived at a semi-ready protocol. So if we can assess now, is it possible to assess at the end then to be able to check what they've done then if we can't have any group to because of the want of time, if they can probably at that time we'll have access to the document to check what they've done, then we'll be able to provide feedback.
Okay, no problem. Yeah, Dr. Leonard, I mean, they have up till Thursday to still work on whatever is left from today.
So that we won't rush them, they will have ample time to still on their own discuss what in their various group discuss. Then have arrive. But if there's any group that think okay they've done something substantial, we can take maybe one or two to just see okay if they are doing the right thing to probably make just some few general comment.
Yeah, sorry, Dr. Leonard, to be fair, can we just give them 5 minutes?
No, that's fine. 5 minutes is fine. Yes.
Okay, thank you very much. So we are going to open the breakout rooms now. Please just join us as soon as you can. It's open now.
Hi everyone, we are back out in the main room.
Hi,
Everybody
Julian.
has returned. Everybody has returned. All right. Can we have call upon one group who think that they have done sufficient discussion? You don't have to get everything correct, but at least sufficient discussion to show Dr. Leonard that you're on the right track.
All right. I think last week our team Yaoundé did not present, so we try to present today. Just start from downstairs.
No problem. Go
Okay.
ahead. What group are you
All
in?
right. Yaoundé.
No problem. Go ahead.
All right. So I will share our work here. So this is what we are able to put through. So previously, and this was our research question. So we look at, among female youths in Africa, so does access to free breast cancer screening services compared to PET screening services improve early diagnosis of breast cancer? So that was our research question. So we try to improve the eligibility criteria here. So we started with the inclusion criteria. So for the population, so we are interested in female youths, mainly 18 to 35 years in Africa. So for the interventions, we're looking at the free breast cancer screening services using the ultrasound and mammography. So for the comparison, we're comparing with PET's other breast cancer screening services using the same ultrasound and mammography. So our interest is on the free and the PET. So for the outcome, we want to see the early diagnosis and mostly at stage 1. So specifically. So for language, we only understand English, and we tend to include only studies in English language. And for the publication status, and we are more interested in the randomized control trials and cohort studies that are published in journals that have already been published. So for the time frame, we chose the 2010 to 2025, a 50-year period. And for the settings, we are more concerned about the urban settings. So because we look at the mammography and ultrasound are mostly found in the urban settings, and findings are more valid, maybe more valid. So for the exclusion criteria, is just like so we are excluding studies on males because there is a male breast cancer.
One second, Stella. Please have your mic muted. Go ahead, Mr. Shafet. Go ahead, Mr. Jonah. Continue.
All right. So for the exclusion the criteria, so we are more concerned on female breast cancer. So we are excluding studies on male breast cancer. Then among youths and less than 18 years. So like any studies on females less than 18 years and above 35 years will be excluded from the study. So then those studies, they examine using clinical breast examination will be excluded. And then the studies, that are conducted not in Africa, in other part of the continent will be excluded. The studies in rural settings will be included because we feel like the findings of that study, and since we are concentrating on ultrasound and mammography, the feasibility and also the validity of the results may not be okay with what we want. So then, and the studies are not included in English, we'll exclude it basically because we don't understand English, and it will be more difficult for us. So getting an interpreter will be like taking a time constraint and also adding more resources. So we're excluding case reports, editorials, and the commentaries and the conference abstract. So because of the strengths of this. So here, studies are before 2010. So we are excluding it. So I think that is basically what we are able to do within the time frame given to us. Thank you.
Okay. Mr. Jonah, this is excellent so far. I'm really good. I would like Dr. Leonard to critique what was presented by his group, please. Dr. Leonard, are you there?
Very well. Yes, I'm here. So please, can you go to the research question? I want to see the question first. Your research question from where you designed, or the topic from where you designed your. Can you move into the research question?
Yes. It says among female youths in Africa, does access to free breast cancer screening services compared to paid screening services improve early diagnosis of breast cancer?
Yeah. Okay. All right, go to what you designed. So, okay, female youth, 18 to, no, just leave it there. 18 to 35 in Africa, yes. Breast cancer screening services using ultrasound and mammogram. Okay. Okay. Paid service. That's okay. Basically, the intervention is probably if I need to kind of just critique the intervention you put there. Both the screening are actually intervention. So you need to note that. So the intervention you are basically looking at here is paid or unpaid. But I'm just thinking, how will you be able to use it to measure early diagnosis? Because the two actually end up measuring, trying to check diagnostic. Early diagnosis, because the reason why you do screening at all is to arrive at early diagnosis. So if I'm to reframe the question actually is to look at if it's early diagnosis, but looking at the free, I think you need to be specific when you say free breast cancer screening using ultrasound and mammogram, then paid. So are you trying to, I think the research question should be if cost, because it's cost you're actually trying to, your research question should be looking at if cost have, if cost of screening have impact on the early access. Actually, I think it should be around cost and access. If cost, we usually minimize access to screening, basically, because if you are talking about just trying to look at early diagnosis, it's not really. I'm trying to just be so that I will not, because what costs do basically is to look at access. Is access that cost control, because if it's free, more people will have access to the screening. So automatically it will result to early diagnosis. So if it's not free, then it means that you have to pay for it. So I think it should be around if payment for breast cancer screening services, we have impact on access. So that is, what you guys did is fine. It's great. But you need to just try to rethink what you're really trying to measure, because both the free breast screening using mammogram and the paid, both of them will lead to early diagnosis stage of cancer, of breast cancer. So I think it should be around if payments have impact on access to early screening. So I think that's how the question should be. Or does any other person have a comment? Or do you want to justify why you think? Because when you say free breast cancer screening service using mammogram, then paid using mammogram, we end up having the same. The intervention here is actually payment, basically, whether you paid or you don't pay. All right, I think, is it Mami Ukwa hand is raised?
Thank you. I wanted to ask a question about the exclusion criteria, excluding studies not in English. I'm wondering if that is not too restrictive.
Yeah, you're very correct. If you are going to include that, then you have to include that in your limitation. That if you do that, there's not going to be penalty for it. But the only thing is that when you're reporting, talking about transparency, so part of your limitation you're going to be reporting is that you couldn't, you only include study from study that report in English language, as such that there is a possibility for elimination or non-inclusion of some studies that were published in other languages. So one of the ways through which you can overcome it or can overcome this is if you have colleagues that are in French that are also in the team, they can work on that. Or if you have colleagues that are also probably in Arab that speak Arabic, they can also work in that. But if that is not visible, if all of them has to be in English, then you have to include the transparency aspect of that you're only including study in English, and as such, you need to then include the possible impact that is going to have on the conclusion. So that when you are discussing, even when you are very careful to making a very generalized conclusion because of the limitation that is associated with the your study selection. So is that clear?
Okay, thanks so much for contribution from the group and Dr. Leonard. Due to the interest of time, we will have to wrap up. And Dr. Leonard, just to let you know, we are free to browse all the Google documents for all the groups by Monday.
Okay.
To get the feedback to see if they are on the right track, because they have until Thursday to submit. All right, if that's okay with you, and all groups to continue to go back and work together.
Sorry, what you need to do then, you need to give me access to the document because I may
Yes,
not
we will grant you access to the document and you'll be able to browse it by Monday. So asking all groups to continue to work with each other in the chat group and in using the Google Doc, so that Dr. Leonard could kind of browse it, give you some pointers, and that you submit by Thursday. So everybody's okay with that? Since that is the case, we will now wrap up, and thanks everyone for joining, and please make sure you follow all the rules and instructions in submitting your assignments. So thank you everyone, and have a pleasant evening or good or